Welcome to the Orthopedic Pre-Surgical class. We are honored that you have chosen AdventHealth to help guide you on your journey through orthopedic surgery. As orthopedic navigators, we will collaborate with your doctors, nurses, therapists, and care manager to allow for a smooth care process, recovery, and access to support services. Our goal is to assist you in understanding what will be happening during all phases of your orthopedic surgery using a multidisciplinary approach. Today we will go over the Creation Health philosophy, pre-surgery planning, preparing your home, nutritional considerations, what to expect before surgery, the day of surgery and after surgery, therapy services, discharge planning, knowing your zone, and we will address frequently asked questions. Creation Health is the whole person health philosophy embraced by AdventHealth to help individuals achieve maximum health and wellness. Our goal is to positively influence all aspects of your life, mind, body, and spirit. Choice is establishing control over your life by making wise choices which lead to improved health and a longer life. Rest, getting a good night's sleep and taking time to relax during the day can lower blood pressure and reduce stress. Environment, pleasant surroundings can lead to inner peace and happiness. Activity, regular physical and mental activity can greatly improve your quality of life. Trust in your faith and nurture your relationships to promote healing and security. Interpersonal relationships, socialization is important to our health and well-being. Outlook, a positive attitude can strengthen the health of your mind, body, and spirit. Nutrition is the fuel that drives our whole system. Our goal is to set you up for success. Elective joint replacement surgery is a collaborative process where healthcare providers do 20% of the work and the rest of the 80% is up to you. Coaches play an important role in your recovery. Coaches can be a spouse, family member, close friend or neighbor, someone who can stay with you or someone you can stay with immediately after your return home from the hospital. Coaches build your confidence, provide much needed support, ensure a safer and faster recovery with improved results. The role of the coach includes providing motivation, taking care of pets, providing or arranging your meals, monitoring your medications, and provided much needed emotional support during recovery. Before surgery, your physicians may order specific tests to clear you for your upcoming surgery. You will be instructed by your physician's office on when and where to go to have this completed. You will speak with a pre-admissions nurse to discuss medications, past medical history, and provide specific instructions related to your surgery. This could be done in person or by phone. You will also get a phone call to tell you what time to arrive at the hospital for your surgery. It is recommended that you stop smoking before and continue to not smoke after your surgery. Smoking may increase your risk for infection and decrease the healing process. TobaccoFreeFlorida.com is a great resource to help you quit, offering free counseling and other services. Please have a discussion with your surgeon as to pain control and the current use of narcotics. Prior to surgery, please have a discussion with your surgeon if you are taking any of the above listed medications. Be specific regarding any herbals, supplements, or non-prescription medications. Some may have additives that can increase your risk for bleeding. If you are taking a prescribed blood thinner, your prescribing physician will instruct you on when to stop taking it. Going home is the goal. Please take some time now to physically prepare your home as well as plan for assistance once you are home. It is important to make modifications to your home prior to surgery. This will decrease your risk of falls or injury. Move electrical cords away from walking paths. Avoid low surface chairs and sofas. You may need to add folded blankets in the seat to raise your posture. Use chairs with armrests that don't swivel or have wheels. Remove throw rugs. Check the width of the paths in your home. Are they wide enough for a walker? Please delegate pet care to your coach until you are recovered. Stairways. Check to make sure stair tread is intact. You will also want to check to make sure the handrails are stable. Check to make sure all your lights are functioning in stairways, entryways, and hallways. Please let the therapist know if you have stairs at home. We will help you practice prior to going home. Typically, you will go up with the unoperated leg and down the step first with the operated leg. So, good leg up, operated leg down. In the bedroom, make sure there's a clear path between the bed and the bathroom. Have a phone and lamp within reach for easy access, and always sit when dressing to prevent falling. It is important to have adequate lighting, such as night lights, to help prevent falls. You may want to install handrails in your bathroom and shower for additional safety, avoiding suction cups. Skid-resistant strips or mats are helpful in preventing slips and falls in the shower or tub. Your therapist may suggest a 3-in-1 commode as both an over-the-toilet seat riser and a walk-in shower chair. Never use a 3-in-1 commode in a bathtub. Plan ahead by storing frequently used items in the kitchen at waist level and less frequently used items in higher or lower cabinets. It is also helpful to prepare and freeze meals prior to coming to the hospital. Nutrition plays a vital role in your recovery after surgery. The nutrients from food provide us with the strength, energy, and ability to heal. People who are well nourished overall are less likely to develop infection and heal faster. It is normal for your appetite to be decreased after surgery. Eat a small amount of protein at each snack and meal. Protein contains all the essential amino acids to aid in wound healing and to keep your immune system strong. Protein is not just for muscle building, it is a key nutrient in bone building. Some protein-rich foods include egg, meat, poultry, fish, peanut butter, milk, yogurt, tofu, beans, nuts, seeds, and soy. Healthy nutrition is very important before and after surgery. Your doctor will determine the appropriate diet for you after discharge based on your medical history. Some nutritional considerations include calcium and vitamin D sources, including milk, cheese, yogurt, and soy milk. Iron-rich food sources, including dark green vegetables, dried fruit, liver, watermelon, and dark meat turkey. Fiber-rich foods can help avoid constipation. It's important to increase your fiber intake slowly, along with adequate fluid intake to avoid gas, bloating, and constipation. Fiber-rich food sources include whole grains, bran, fruits and vegetables, beans, and lentils. Vitamin C is needed to make a protein called collagen, and is needed for repairing tendons, ligaments, and healing surgical wounds. Vitamin C-rich food sources include citrus fruits, strawberries, kiwi, baked potatoes, broccoli, and bell peppers. Zinc is important for wound healing. Zinc is a mineral found mostly in animal foods. It is better to get zinc from foods rather than supplements. Zinc-rich food sources include meat and fish, poultry, dairy, whole grain breads and cereals, nuts, dried beans, and peas. Adequate hydration will prevent constipation as well as promote healing. Unless your physician is restricting the amount of fluids you drink, the focus should be on drinking 6 to 8 glasses of water a day. Your pre-admissions nurse will instruct you on which medications, if any, to take the morning of surgery. You may be instructed to not eat or drink anything after midnight the evening before your surgery day. We will increase your diet slowly after surgery, usually starting with clear liquids first. Sometimes anesthesia may cause nausea, but you will have medication ordered for this should you require it. The night before your surgery day. Pack your bag. You will be staying with us for 1 to 2 nights. Place all of your belongings in this one bag to prevent any misplaced items. And remember to pack charging cords for any electronics. Consider placing your bag in the car the evening before surgery. Some items to include are loose-fitting clothes, walking shoes with rubber soles, hearing aids, glasses, and dentures, your CPAP machine, and a list of your medications. Avoid bringing any valuables with you to the hospital, and please remember to remove nail polish. Preoperative showers. Skin rashes or inflammation should be reported to your surgeon before your surgery. Do not shave your legs within 48 hours of surgery. You will be given instructions regarding the preoperative chlorhexidine prep showers. Use as directed by your healthcare team. Make sure to keep the chlorhexidine away from your eyes, away from the perineal area, and report any allergies to your physician. Do not use lotion or powder after using chlorhexidine prep, and sleep in clean, freshly changed bed linens and clean pajamas. The day of surgery. Arrive on time. You will be notified by phone of your arrival time and the surgery time. Typically, you are asked to arrive 2 hours prior to surgery, and surgery could take anywhere from 2 to 4 hours. The surgeon will speak to your family after the surgery. After surgery, you will recover in the post-anesthesia care unit, or PACU. In this recovery room, the nurses will monitor you until you are ready to transfer to the nursing unit. We will ask you your name and date of birth multiple times. This is our safety check. Once discharged from the recovery unit, you will be admitted to the nursing unit. Nursing staff will visit you hourly, assessing your blood pressure, heart rate, respirations, and comfort level. Hand washing is the #1 way to prevent infection. All staff and visitors should wash their hands frequently. Do not touch your incision site, and no picking. You are also at risk for falls. For your safety, please do not try to get up by yourself. Always call for help. Your surgeon will order medications to prevent constipation and to prevent blood clots. You will be provided education on possible side effects. Other therapies to prevent blood clots include sequential compression devices, or SCDs, and compression stockings, or TED hose. You will be given an incentive spirometer to encourage deep breathing and to aid in preventing pneumonia. We will get you up and out of bed soon after surgery. Continue to do your ankle pumps as instructed. Communication is the key to pain control. Nurses will round hourly and ask you for your pain level using a scale of 0 to 10. A pain score of 0 is no pain at all, whereas 10 is crying or unable to speak a complete sentence. The pain goal after surgery should not be a 0. Aim for a realistic goal postoperatively. The goals of pain control are ensuring you're able to talk, walk, eat, deep breathe, and participate in physical therapy. Please do not wait until your pain reaches a 10 before taking your pain medication. It may be helpful to take pain medicines prior to physical therapy. And please do not skip or decline physical therapy sessions due to pain. Asking questions about your pain regime is important so you have a full understanding of what medications and alternative plans are available for you to help manage your pain in the hospital and when you go home. As your pain lessens over time, you can slowly wean off your pain medicines. Your surgeon will use a multimodal approach to manage your pain, which means the use of medicine, narcotic and non-narcotic, and additional alternative therapies to help control your pain. There are many other therapies available to help alleviate your postoperative discomfort. You may be sent home with cold therapy, but please check out some other non-narcotic ways to feel better. Post-surgical therapy. Physical therapy will come see you in the hospital and customize a therapy plan that works best for you. What is therapy? Physical therapy, or PT, focuses on functional mobility. It is extremely important to give 100% and participate in all therapy sessions. Getting up and out of bed into a chair for all meals is important. The physical therapist will adjust the walker height, educate you on your home exercises, take you for a walk, go over getting in and out of the car, climbing up and down stairs, and provides you with home safety tips and fall prevention guidelines. It is important to start some therapy exercises now, before your surgery date. This will help with strengthening and muscle memory. Please do not do any exercises that cause you severe pain. Gluteal squeezes strengthen the buttocks muscles, which is important for walking. Quadriceps setting is important so your knees are straight when you advance the leg forward and put your heel down. Ankle pumps can help prevent circulation problems, such as blood clots. Practicing getting in and out of a chair. Chair push-ups are initially good to strengthen your arms. As you develop strength and know how to position the leg after surgery, you will use your arms less when getting to standing. Please refer to your books for additional exercises and instruction. For the knee replacement patient, focusing on bending and straightening your knee is a very important goal to obtain as soon as possible after surgery. As your body heals from surgery, scar tissue can limit the motion to the joint if bending and straightening of the knee is not done right away. The sooner motion to the joint is obtained, the sooner you will meet your therapy goals. Your physical therapist will teach you the appropriate equipment to use on level surfaces and stairs. A walker will always be used while ambulating. Avoid pivoting on your new knee and avoid placing a pillow under your knee until instructed otherwise by your surgeon. If you are having hip surgery, make sure your knees are lower than your hips when sitting. Keep your toes pointed upward when in bed or in the chair. A front-wheeled walker will always be used while ambulating. Follow your physical therapist's instructions, as you may have different precautions depending on your surgery. Some precautions may include avoiding crossing your legs, bending more than 90 degrees, and twisting or turning at the waist. Some types of hip replacements require the use of an abduction pillow to prevent your legs from crossing while in the bed. Discharge planning. Our goal is to safely transition you from the hospital setting to your home. This is an elective procedure. The recommendation is for patients to return home after surgery. It's very important to us that you have a safe discharge plan. What is your plan for assistance after surgery? Speak to family and friends to make those arrangements before your surgery for a smooth and safe transition home. A care manager will come see you while you are in the hospital. They can help finalize home care and order equipment you may need through your insurance. Please be aware raised toilet seats and shower chairs may not be covered by insurance. The care manager will discuss this during your stay. You will be discharged home as soon as you have met your discharge criteria. At your postoperative visit, your surgeon will decide if outpatient therapy is required after in-home therapy has been completed. You may not drive until cleared by your surgeon. You will need somebody to transport you home, bring you to your physical therapy sessions and doctor's appointments. Consider the type of vehicle available. A low car or high truck are not the best options. Things to consider for a safe transition to home include a clear path from the passenger side of the car, removal of garage clutter, and bushes trimmed for a clear driveway. Postoperative risks. Potential signs and symptoms to look for regarding a blood clot in either leg include swelling that does not decrease with rest, cold therapy, and elevation, calf pain, and redness. Pulmonary embolism, or PE, a blood clot in your lung, can present with chest pain or sudden shortness of breath. If you experience any symptoms of pulmonary embolism, you need to call 911 right away. Do not try to drive yourself to the hospital. Once discharged from the hospital, you are still at risk for complications. Your role in helping to prevent complications include taking the medication prescribed to prevent blood clots as ordered, performing your daily exercises and ankle pumps throughout the day, wearing your TED hose as ordered, bringing your incentive spirometer home from the hospital and continue to use it, taking your stool softener, drinking plenty of fluids, and increasing the fiber in your diet, washing your hands frequently, Avoid touching the incision and reporting any concerns of redness to the incision. Using cold therapy and elevating as instructed. It is important to know your zone. If you are in the green zone, your symptoms are under control and you are progressing well. If you reach the yellow zone, this warrants a call to your surgeon's office. If you reach the red zone, you need to go to the emergency room. Please call 911 and do not attempt to drive yourself. Now for some frequently asked questions. When can I drive? Not until cleared by your surgeon. How will my pain be managed? With a multimodal approach, which includes non-narcotic medications if ordered by your surgeon, cold therapy, rest, and elevation. How long will I be in the hospital? Roughly 1 to 3 days, depending on your progress. Our goal is to get you back home as soon as you have met your discharge criteria. When can I get out of bed? We will be getting you up out of bed within 6 hours of your surgery. Early ambulation decreases the risk of complications. Will I need a blood transfusion? We typically do not give blood transfusions after surgery unless medically necessary. And regarding future dental work, will I need antibiotics? This varies from surgeon to surgeon. It is best to check with them prior to having any dental work done and notify your dentist of your joint replacement. Key points to remember. The number one way to prevent infection is hand washing. Wash your hands frequently and do not touch your incision. Always get up with your walker and use assistance. Always call for help. Potential complications after surgery include blood clots, infection, constipation, and pneumonia. To prevent blood clots, take your prescribed blood thinner, ambulate with assistance, do your ankle pump exercises, and wear your TED hose. If you live by yourself, be sure your surgeon is aware of your concerns and a plan is in place before you come to the hospital. Investigate other options to help at home. The quickest way to recovery after surgery is not to lay in bed, but to work towards resuming your normal activities by doing your exercises and following your physical therapy instructions. We cannot guarantee you will not have pain after surgery, but we will provide prescriptions and strategies to keep you comfortable as you recover. Please contact your campus orthopedic navigator to confirm completion of your pre-surgical education and for any additional questions or concerns. Please take note of the confirmation number listed on this slide and be ready to give this number to your orthopedic coordinator.